Hello, everyone. Welcome again to yet another webcast in our course series. The topic today is the role of nurses in breast biopsy. This is based on slides prepared by Mrs. Lillian Smart, a nurse at Abia State University Teaching Hospital, Nigeria. Our objective at the end of this topic in the course is that participants will gain an understanding of what breast biopsy really is. They get to appreciate what happens during breast biopsy and what nurses can do before, during, and after breast biopsy. So basically, this talk is to kind of walk you through what is in the slides to help you understand as you read the handouts. Breast biopsy is a procedure that is performed to confirm or rule out breast cancer after clinical breast examination or mammography or ultrasound has identified a mass. So basically, when we found that there is something suspicious in the breast, the next step is usually to find out what that thing is, and the, that's what the biopsy does. And there are many ways of doing this biopsy. One could be fine needle aspiration biopsy, where we aspirate the fluid from the mass, or the other could be core needle biopsy, which is actually what we are promoting in this course, and that is using a wide bore needle to get the tissue. The other could be open biopsy, where we actually open up the breast using a more extensive surgery to bring out the mass in whole. Okay, so if we are doing a breast biopsy, it could be image guided, meaning you could be using radiologic images to guide it. In this picture here, what we're seeing is someone doing ultrasound guided breast biopsy, and the next picture shows what is called stereotactic breast biopsy. This is largely done using a mammogram to localize the mass, and then the biopsy needle goes for it, as you can see in the picture. Okay, so now breast biopsy can be performed in various settings. So the question here is, where is a breast biopsy performed? It can be done as a day surgery, meaning it is done as an outpatient thing under local anesthesia, and it can also be done uh, as an inpatient procedure where the patient is kind of kept overnight and monitored. So what really happens when a patient is going for biopsy? Well, first the patient is exposed properly. They might need to undress or change into something else. They'll be comfortably positioned, and then let's say in the recumbent position where the patient puts her arm behind her back, and then the biopsy site is prepared using local anesthesia, and then we get the tissue. So if it is fine needle aspiration biopsy, a slide is made out of whatever is what we aspirated using the syringe. Now this aspirate is examined under the microscope to find what kind of cells are there. Now after the biopsy, of course, you don't want the patient to bleed, so you apply pressure on the biopsy site and bandage it up, and the patient can get to go home. That is simply what happens in summary during fine needle aspiration biopsy. And what about open biopsy? Well, of course, patient might receive general or local anesthesia. The doctor makes an incision at the site and removes either a portion of the mass or all of it, and it is sent into the lab. You, of course, is sent to the lab in a properly labeled specimen bottle that most times contains formalin. I'm sure you all are familiar with this. Then the wound is closed up and pressure dressing is applied. So in the next few slides, we will be going through precautions we need to take as nurses or contraindications to breast biopsy, and some of them could be, I mean, some of the factors that interfere with biopsy would be if you cannot obtain a good specimen, or if you cannot place the specimen in a proper solution. Either of these two factors will limit the quality of your biopsy, or the quality of the results that can come from your biopsy. There are the cases where people take biopsy and they put the thing in normal saline. That is not good, and so it's always good to put the right solution. But of course, there are conditions where a patient might not be suitable for surgery or for biopsy, and it is important the nurse knows this. So, for instance, if a patient is taking a drug that interferes with blood clotting, and the biopsy would involve opening up the patient to an extent, you might want to discuss with the patient or the doctor regarding this, to either postpone the biopsy for a few days while you stop a drug that might affect blood clotting, like aspirin. So we go on to the role of nurses before a biopsy, and patient patients trust nurses a lot. This is very good. This is a gift. So the nurse is there before a biopsy to essentially offer support to the patient and make sure we are dealing with the right patient. So first you get to confirm the patient's identity and counsel the patient about what the procedure is, just like I kind of introduced earlier. And then you offer emotional support and help walk the patient through the procedure. Now, you can also tell the patients a little bit about, not just a little bit, as much as they'd like to know about what foods to take or what medications to stop, and explain to them what happens, what kind of tests they need to do before the biopsy is done, such as chest X-ray if necessary, and then also let them know what they should be doing after the biopsy. That is all part of the counseling, and it is important to check the patient's history for hypersensitivity to anesthetics. Okay, so if it's doing a biopsy, the role of nurses here depends on who they are working with in terms of the doctor. So the doctor might need them to assist in collecting specimen into containers, or they might be required to um, label specimen bottles, whatever. It depends on what happens in your team. And then after biopsy, of course, nurses have very huge role. So you try to keep the patients comfortable, and if patients receive general anesthesia, you could check the vital signs every 15 minutes for the first hour, then every 30 minutes for the next 2 hours, and every hour for the next 4 hours, and then the patient is ready to go home. Of course, you all know how to monitor for pain and provide analgesia. And then it's important to instruct the patient to wear bra support all the time until the biopsy wound heals, and let them and counsel them to observe for and report bleeding, tenderness, or redness at the biopsy site. Of course, nurses are very good at providing emotional support, and it's expected that you'd also continue this role after breast biopsy. So the next few slides are regarding what people should be aware of after biopsy. So, I'll go through a few of the points here. The rest will be in the handouts. That the dressing over the biopsy site may be removed after 48 hours. But while the dressing is in place, please and ensure the patient, or can advise the patient to not uh, to make it wet, and then so they don't have to have a shower involving that breast within 48 hours after the procedure. And if they are working, they can return to their normal activities the day after the surgery. And then also encourage the patients not to be alarmed if they notice any bruising around the area. The bruise will typically fade. There are lots of instructions around this in the handout. And then, but you have to inform the patients after the procedure. This is very important, that if they notice they're having fever, or there's bleeding at the site that will not stop, or the breast is swelling, or they have severe bruising, or even unusual pain, maybe any symptom at all that they find alarming, they have to notify the hospital or the clinic as soon as possible, because there's always a risk for infection whenever you do a procedure like this. So it's good to catch it early. Anyway, so the next few sections are kind of talking about questions that patients may ask you as a nurse about breast biopsy. So that is what is concerned, and I'll encourage you all to go through them. So in summary, nurses can play a very huge role regarding breast biopsy. These roles are played before, during, and after breast biopsy. But what you get to do depends on who you're working with in your team. So we'll encourage you to, connect in the chat rooms for the course and ask questions. Thank you all. Bye bye.